Pain can be debilitating to someone on a daily basis. There is a new technology in the treatment of pain. To know more about it, let's talk to Dr. Surabhi Kalita Khanikar, consultant pain specialist, Narayana Super Speciality Hospital, and also the founder of Narayana Pain Clinic.
Hello.
Doctor, can you tell us about the concept of pain management or pain clinic?
Okay. So, Pain Clinic actually is a very comprehensive pain treatment center which is focused on the patient. We understand that pain can be a very, very difficult thing to endure for the patients. It affects the patient in every aspect, their body, their mind, and their spirit. So, in pain clinics, we come with a multidisciplinary approach to the treatment and diagnosis of pain. Here, we have all the specialties under one roof. See, the problem today is we have got pain physicians who are doing pain interventions, the surgeons who are doing surgeries. Likewise, we have other specialties like image specialists or radiologists, then physiotherapists, psychiatrists, psychologists, and other general physicians. They are all working independently in their own fields. But in such a system, it is very difficult for the patient to navigate the system and go to the right person concerned for the treatment of his pain condition. So, in pain clinics, under one roof, we bring about all these specialities so that we can coordinate and collaborate and come together with a treatment plan which is holistic in approach. But sadly, in today's health scenario, such a comprehensive pain clinic is still very rare to find actually. But with time, I guess people will be more aware and such pain clinics will be more common to be seen in our healthcare facilities. In pain clinics, actually, we deal with any and every kind of pain. But the most common kinds of pain being back pain, that is lower back pain or sciatica as people generally call it. Then also cervical spondylitis, various kinds of sports injury pains, joint pains like arthritic knee pain, shoulder pain, elbow pain, wrist pain, ankle pain, etc. We also deal with some rare disease conditions like fibromyalgia, which is very difficult to diagnose and treat actually because there is no particular blood test or there is no particular X-ray or imaging to diagnose fibromyalgia. The patient is in constant pain. He does not or he or she doesn't know whom to go to, but then ultimately the patient is suffering. So such conditions we take care of. Also, we have facilities to treat cancer pain. So there are many interventions which we do and help patients suffering from cancer pain. So precisely we deal with all kinds of pain actually. You can see we also deal with all the neurological pains like headache, migraine, and then trigeminal neuralgia is another condition which we treat in which there is excruciating facial pain. So patients sometimes have suicide tendencies. The pain is so excruciating. So we deal with all those kinds of pain in a very non-surgical manner.
Okay, thank you, doctor. So, could you tell us what are the minimally invasive pain treatments or pain procedures?
Okay, see the paradigm which we were taught when we were in medical school as students where once we start having a pain, say a back pain, we would first go to a primary pain physician who would give us a simple set of medications, and if we are not relieved, then directly we are offered the other next treatment, that is surgery. But minimally invasive pain and spine interventions sits right in the middle of that paradigm or that spectrum, and sits right in the middle of that spectrum, and it bridges the gap between pharmacological therapy or medications and surgery. So minimally invasive pain and spine interventions, or MIPSI as we call them, these are very specific set of interventions or services we offer to the people. And these interventions are very, they are very safe you can say they are bloodless, and they are daycare procedures that the patients will come in the morning and they will go in the evening. They do not have to stay in the hospital for that. And the best part is they can walk out of the pain clinic in a very pain-free manner. That is, they get instant and significant pain relief without any side effects. So until even recently, even 5 years back, you can say this kind of minimally invasive interventions were not available to the patients. So in this middle ground between medications and surgery, patients get cured. To give you some examples of minimally invasive interventions which we as pain specialists do are delivering the highest concentration of the most potent drug right at the pain generator site with the help of special machines called fluoroscopes or ultrasounds. Another intervention which I would like to talk about is the platelet-rich plasma or PRP therapy. Here what we do is we take out blood from the patient and we centrifuge a portion of the blood and take out a portion which is very rich in plasma, which is called the platelet-rich plasma or PRP. This portion is very rich in platelets, and we inject this portion into the system or into the pain generator site with the help of a fluoroscope or an ultrasound, and it not only relieves the pain but it also helps in regeneration or repair of the tissue. Again, another breakthrough technology is stem cell therapy. Stem cell therapy also acts in a very similar manner as PRP. Then we have radio frequency ablations, where we use radio frequency to burn those baby sensory nerves which cause pain at the pain generator site. We have neuromodulation or spinal cord stimulation. We have intrathecal pumps. We have ultrasound guided procedures. We have Botox infusions for treatment of spastic neuropathic pain. So we have got a whole lot of interventions to be done in the name of minimally invasive pain and spine interventions.
Okay. So doctor, do you feel that drugs or medicines have taken over the treatment of pain among practitioners in present day?
Well, sadly, yes, I would agree to that point. Actually, if you see today, the pharmaceutical companies have come out with so many medications that doctors have become symptom managers as opposed to healers. So we as pain physicians, we try to change that treatment philosophy, and we would like to deal with the patient in a more holistic way. We would like to really get into the depth of the problem, trying to find out what is causing this problem and try to find out a permanent cure to the problem and not only the symptom. So I agree that medicines or medications will definitely be a part of it, but then there are many other aspects, and a psychological aspect is one of the biggest aspects which we tend to overlook. So we need psychological counseling, we need something called CBT or cognitive behavioral therapy. So the yoga and meditation also forms a big part of pain care. Of course, there are minimally invasive pain and spine interventions that we have, and last resort being surgery. So it is a very holistic approach, and we have to really get into the depth of what are the issues leading to those sufferings and all the surrounding problems that the patient may be surrounded with. So yes, medicines are a part of it, but there is a whole array of treatment that is to be given to a patient with pain.
Okay. So doctor, where do you see the treatment of pain in the next 5 years?
Well, I hope in the next 5 years, I definitely see people, the pain specialists, the doctors, the other specialists, all will have a comprehensive, and they will all collaborate and come up with a very holistic approach to treatment of pain. People will be aware that there are many other options apart from medicines and surgery available to them. There will be fewer surgeries, there will be lesser surgeries, there will be lesser prescription of expensive medications for years and decades to heal, to control symptoms like pain, and there will be a real, you can call revolution in the treatment of pain in the next 5 years.
Thank you so much, doctor. It was really helpful. I hope that this will really enlighten a lot of people about pain therapy. Thank you so much.
Thank you.